We are live, doctor. You can start the session.
Okay. So happy New Year, friends, and my respectful pranam to all the mentors who have logged in today. So this is a pan-India intercollegiate quiz. This is being done by Brain Teasers in association with Ophthalmological Society of Nagpur, and the program is Big Q. And this is the signature tune of our Brain Teasers, which have been ringing on your ears for the last 5 years. This tune has been popular for last 5 years.
Doctor, you need to share sound.
Oh, sorry. You should have told me. 1 minute. Okay. So friends, after the first 3 successful season for the big online quiz for the general ophthalmologist of our country, we initiated 2 years back the online quiz for all India postgraduates. And this is the
समंदर अपना अंबर खोज ले अब तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर हट समंदर अपना अंबर खोज ले अब तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर
So once more, Happy New Year and welcome to this 4th episode of Big Q. Good evening, friends, and my pranam to all the mentors. The Brain Teaser team welcomes you to this 4th episode of this season 3 of Big Q once more. As I said, Brain Teaser is an online platform for hosting quizzes for all ophthalmologists of our country, which we have been doing since last 5 seasons and rather years. It's since last 2 years that we are having an exclusive quiz for all India postgraduates with the aim of getting all postgraduates from across the country on a single platform. There are approximately 320 institutions offering post-graduation in ophthalmology, be it MS or DNB. The first season was done in association with Bombay Ophthalmological Society, and last 2 seasons, this seasons we have been doing with Ophthalmological Society of Nagpur. The Big Q started with a lukewarm response with participation of about 200 teams in the first season, and the peak was in the last season when we had almost 680 teams registered. Even this season, we have about 400 plus teams who are participating. Just for the sake of people who have joined in lately, this third season would have 8 preliminary rounds, 4 quarterfinals, 2 semifinals, and 1 finals. So total 15 episodes. These episodes would be aired on alternate Wednesdays at 8 p.m. Brain Teaser is extremely thankful to the team of quiz masters who toil hard to create a wonderful experience of learning with fun. Today's episode, we have some new quiz masters along with few who have been associated with us in some last season. And today it's all women power. We welcome Dr. Naina Poddar, who is currently professor and head of the department at Topiwala National Medical College and by Yamuna Bai Lakshman Nair Charitable Hospital, Mumbai. Dr. Sarika Sethia, owner of Indovision Cataract and LASIK Eye Hospital, Pune, and consultant at Sanjeevan and Sahyadri Hospital, Pune. Dr. Prabharisha Banerjee, who is currently associated with AIMS Kalyani. Dr. S. Venipriya, who has a teaching experience of almost 13 years in various medical colleges. And Dr. Gunjan Buddharaja, who is working as a cornea, cataract, and refractive consultant at I7 Hospital, New Delhi. Welcome all of you, ma'am. And I salute to all this women power, along with the women who is seated besides me, the lady, Dr. Shilpi Narnore, for making this quiz. I'm sure going to be a big success. An old saying says that money maketh the mayor go, and such mega projects are not possible without a strong financial support from farmers. Microvision has been our steadfast partner with since last 3 seasons. My sincere most gratitude to Mr. Ashokan, Mr. Kumaran, Mr. Navneet for their support. And of course, I would fail in my duties if I don't acknowledge the field force of Microvision, who made so much efforts to enroll all the postgraduates from across the country. Online quizzing, the basic thing is the basic smooth and flawless execution is possible because of a brain teaser platform, which is taken care by Numeratic and team. Mr. Sai, I'm really thankful to you for all this. Now, I would request Dr. Shilpi to carry forward the further proceedings. Before that, we would begin with the introduction of, we would like to express our gratitude to the trade partner who have been supporting us, and this is a promo from them. Thank you, Microvision, for this support. Now it's my time to hand over the screen to Dr. Shilpi, who is my co-host and who will be familiarizing all the participants with the format of the quiz.
Good evening, friends. Happy New Year to all of you. Welcome back, postgraduates and all the private practitioners. So quickly again, the format and the rules of the quiz. So third season on alternate Wednesdays at 8 p.m. Platform will be Kahoot and Zoom. Total episodes will be 15, 8 preliminary rounds, 4 quarterfinals, 2 semifinals, and 1 final. So today is the 4th preliminary round, and we will be calculating the best 5 performances out of the 8 preliminary rounds. So Kahoot platform, every team needs to log in from 2 devices, one for the Kahoot and one for the Zoom. So first screen is the live quizzing on the Zoom platform, while the second is the Kahoot to answer. Mentors are requested to log in from the separate screen only on the Zoom platform. So in today's quiz, there will be 10 sets. Each set has 5 questions. 10 seconds for each question you will get, and there will be no negative marking. Fastest finger first is a way to calculate who will be the who will score more, and the decision of the judges will be binding for everyone. So these are the mega prizes for the finals for the postgraduates, and also the mentors will be getting these gifts. Audience prizes are per episode. So even in today's episode, audience will get prizes for the top 3 ranks. So just to check whether your Kahoot is working or not, there is a sample question for all of you. The first is, this satellite is launched to have insight into. Your options are lunar missions, black holes, critical data for Earth observation, meteorology and disaster management. And your time starts now. So let's see what's the answer. Yes, the answer is B, that is black hole. So ISRO has welcomed this new year with the launch of its first X-ray polarimeter satellite, which will offer the insights into the black holes. So with this, I'll hand over the screen to our first quiz master, Dr. Naina Poddar, who is professor and head of the department at Nair Hospital, Mumbai. She has total experience of 30 years. Her areas of interest are pediatric ophthalmology, community ophthalmology, and trauma. She is a teacher and PG guide for more than 25 years and the university and DNB examiner. She is an avid researcher and has worked as a principal investigator in various clinical trials. She has many awards to her name. To name a few: National Hero of Maharashtra Ophthalmic Society, Distinguished Professor of Ophthalmology in India, and a Coin Award. She has multiple publications in the national and international journals to her credit. She has presented many papers as a faculty and has been invited as a judge in various conferences. So with this, I hand over the screen to Dr. Naina ma'am.
Thank you, Shilpi, for the kind introduction. Thank you, sir, Prashant sir, for this opportunity. Welcome to all the participants. Happy New Year to them and best wishes. Shall we start? So, coming to question number 1, the opening question. Which of the following, one second, questions are getting covered, one second. Okay, let me read from this. Just give me, excuse me. Yeah, we shall start now. Which of the following is not a part of inner nuclear layer? The options are bipolar cells, rods and cones, amacrine cells, and horizontal cells. Your time starts now. And the answer is yes, the rods and cones. Rest of the other things, the bipolar cells, amacrine cells, and horizontal cells are a part of inner nuclear layer. Coming to the next question. A 10-year-old male came for routine eye examination with no significant past, personal, or family history. Vision and anterior segment were normal. Fundus picture shows, the picture is on the left side. The options are papilledema, normal fundus, optic disc drusense, and congenitally elevated optic disc. Your time starts now. The right answer is C, optic disc drusense. These are asymptomatic conditions. On appearance, you have a lumpy, bumpy margin, and this appears like a pseudopapilledema, but you can make out that the blood vessels are not affected. You get superior venous pulsations present. So this is a case of pseudopapilledema, bilateral drusense. Next. Question number 3. What is the optimum time to operate this patient with findings shown as in picture? Your options are within the first few weeks of life, as soon as possible, 2 to 6 months, C, 6 months to 1 year, 1 to 2 years of age. The answer is within first few weeks of life. Here you can see the child has visually significant cataract involving the central visual axis, and it's more than 3 millimeters. So such bilateral congenital dense cataracts needs to be operated as soon as possible to prevent stimulation deprivation amblyopia. Next. Which layer of cornea is involved in this dystrophy? The clue is bilateral. So the options are epithelium, stroma, endothelium, Bowman's membrane. The answer is stroma. This is corneal macular dystrophy, which is an autosomal recessive condition wherein mucopolysaccharide deposits are seen as grayish-white opacities throughout the stroma, extending up to the periphery. This is how you can differentiate from the other conditions, stromal dystrophies. Next. Which location of this tumor carries the worst prognosis for recurrence and mortality? The options are lower eyelid margin, medial canthus, central upper eyelid, and lateral canthus. The answer is medial canthus. This is a basal cell carcinoma. The growth appears as a pearly white dome-shaped papule with prominent telangiectated surface vessels. Sometimes the central part ulcerates, then it is called as the rodent ulcer. This is one of the most common eyelid malignancy, accounting for more than 90% of the malignant eyelid neoplasms. Medial canthal lesions are very likely to extend into the orbit, hence they carry the worst prognosis. Next question. Yeah, I think we are done. Yeah, coming to the next quiz master, I welcome Dr. Sarika Setia, who is a cataract and refractive surgeon from Pune, owning Indovision Cataract and LASIK Eye Hospital, and is also a consultant at Sanjeevan and Sahyadri Hospital, Deccan. She has been awarded with the prestigious Health Influence of the Year 22 award by the Lokmat, as well as WS Inspiration Award in 2021 at the Annual Women Ophthalmologist Society. Welcome, Dr. Sarika, to continue.
Thank you, Dr. Naina, for the kind introduction. So moving on to section 2. So the first question of this section, within which orbital bone are the optic canal and foramen located? Your options are A, frontal, B, ethmoidal, C, lesser wing of sphenoid, D, greater wing of sphenoid. The time starts now. So the correct answer is C, lesser wing of sphenoid. So here you can see that the optic canal and the foramen both are located in the lesser wing of the sphenoid. Moving on to the next question. What is the average length of the intraorbital and intracranial part of the optic nerve? The options are A, 2.5 centimeter and 1 centimeter respectively, 4 centimeter and 0.9 centimeters, C, 2.5 centimeters and 2 centimeters, D, 3.5 centimeters and 2 centimeters. Your timer starts now. So the correct answer is A, 2.5 centimeters and 1 centimeter. So we know that the optic nerve is divided into 4 parts. The nerve head, which is 1 millimeters in length, the intraorbital part, which is 25 millimeters in length, the intracanalicular part, 4 to 10 millimeters in length, and the intracranial part, which accounts for 10 millimeters of the total length of the optic nerve. Can we have the next question, please? What is the percentage of riboflavin used during C3R in corneal thickness more than 400 microns? Your options are A, 0.1%, B, 0.01%, C, 0.05%, D, 1%. Your timer starts now. So the answer is A, 0.1%. So pachymetry is performed usually, and the thinnest point, if it is minimum is corneal thickness is less than 400 microns, then we use hypoosmolar riboflavin, that is 0.5%. And for more than 400 microns thickness, we will use 0.1% of riboflavin solution. So which test is being performed here? Your options are A, stereopsis, B, vertical deviation, C, diplopia test, D, dominant eye test. Your timer starts now. These are more practically oriented questions for you all. So the correct answer is, yes, D, dominant eye test. So this is a very simple test which can be done in the OPD to determine which eye is dominant. You need to extend your arms out in front of you and create a triangular opening between the thumb and the forefingers by placing your hands together at a 45-degree angle with both eyes open. Now you center this triangular open on a distant object such as a wall clock or doorknob. Close your left eye. If the object stays centered, then your right eye is the dominant eye. And if the object no longer framed by your hands, then your left eye is your dominant eye. Can we have the next question, please? So name this gadget. A, express shunt. B, Ahmed glaucoma valve. C, Xen implant. D, glauco shunt. Your timer starts now. Okay, can we see the answer, please? So it is A, express shunt. So the express shunt procedure, it is an implant made of stainless steel, which is used under a scleral flap to allow for drainage of aqueous humor in order to relieve the intraocular pressure in glaucoma. So this procedure is very similar to trabeculectomy in that a fluid path is created from the anterior chamber to the outside of the eye. So yes, this section is over, and now I would like to introduce Dr. Prabrisha Banerjee. She's completed her diploma in ophthalmology from Medical College RIO Kolkata, PD DNB from Shankara Nethralaya Chennai, and she's done her oculoplasty fellowship from Shankara Nethralaya Chennai. She's a former associate consultant from Aditya Birla Shankara Nethralaya Kolkata, and currently she's associated with AIMS Kalyani. Very
Thank you,
welcome,
Dr. Sarika, for the kind introduction, and all the best to all the participating teams. Let's begin with the questions. So the first question, what is this finding known as? The options are Francis-Cate sign, option B, fingerprint sign, option C, candle wax dripping sign, and D, Kireli's arteritis. Your time starts now. So the correct answer is option A, Francis-Cate sign. So Francis-Cate sign, this is seen in toxoplasmosis. So healing toxoplasma lesions may be complicated by proliferative vitreoretinopathy, retinal gliosis, and CNVM. So these bands usually link an old scar with the optic disc. The other signs, such as the fingerprint sign, it is an in-phase OCT finding, which is mainly seen in the outer plexiform layer and the Henle fiber layer in any tractional pathologies of the retina. And the candle wax dripping sign, it is seen in the multifocal segmented periphleboitis, which occurs in oculus sarcoidosis. The segmental arteritis or the with the Chilaris plaques, these are seen in infectious and non-infectious posterior uveitis. Moving on to the next question. Which of the following drugs causes honeycomb keratopathy? And the options are A. Latanoprost, B. Brimonidine, C. Netarsudil, D. Dorzolamide. And your time starts now. The correct answer is option C, Netarsudil. Netarsudil, it is a Rho kinase inhibitor drug. So basically it acts on the protein, it inhibits the protein kinase and modulates the cytoskeleton of the trabecular meshwork. It also acts on the corneal endothelium cell structure, and it is assumed that it decreases the function of the corneal endothelial cell protein actomyosin and causes poor corneal endothelial cell integrity. Especially those who have pre-existing corneal pathologies, they are very prone to get this honeycomb epitheliopathy. Next question. Which of the following is most suitable for IOL calculation, IOL power calculation in high myopic patients? And the options are option A, Holiday 1, B, SRKT, option C, Hoffer Q, and option D, Barrett Universal 2. Your time starts now. So the correct answer is option D, Barrett Universal 2. So Holiday 1, SRKT, Hoffer Q, all of them are third generation formula. Whereas Barrett Universal 2 is a fourth generation formula which encompasses more than one single equation, and it also takes into account the effective lens position. So it is more accurate in calculating any IOL power in high myopic patients. Next question, please. Double optic nerve head sign in USG-B scan is seen in all except option A, optic disc drusen, option B, choroidal osteoma, option C, traumatic optic nerve avulsion, and option D, foreign body in the posterior ocular coat. And your time starts now.
Madam, hold on to the answer for a moment. Yeah, please go ahead.
Okay, so the answer to this question is option C, traumatic optic nerve avulsion. So optic disc drusen, choroidal osteoma, and the foreign body in posterior ocular coat would produce this kind of acoustic shadowing, which looks like there is another optic nerve head or the pseudo-optic disc shadow. Okay, next question, please. In a patient with diabetic macular edema, OCT shows hyperreflective retinal foci. Which will be the more effective drug to treat these cases? And the options are ranibizumab, option B, aflibercept, option C, bevacizumab, and option D, dexamethasone. And your time starts now. So the correct answer is option D, dexamethasone. So hyperreflective retinal foci is nothing but their subclinical lipoprotein deposits, which are less than 30 micron in size. So these are important biomarkers of retinal inflammation in the OCT. So studies have shown that these corticosteroid implants, they have a better outcome as compared to anti-VEGFs in these cases, in the patients with diabetic macular edema and hyperreflective retinal foci. I'd be introducing my next speaker, my next quiz master now, Dr. S. Feni Priya. She is having 13 years of teaching experience and she has authored many books such as Target Jipmar and Triple O book. She has been taking ophthalmology classes in NEET PG teaching institutions. She has, to her credit, many published research articles in various national and international journals. She has also presented many papers in various state and national level conferences. And the icing on the cake, she has won the best free paper in the Orbit and Oculoplasty session in TNOI conference in 2022. Over to you, Dr. S. Venipriya.
Thank you, madam. Thank you for your kind introduction. Next question, please. The shortest EOM is, options will be A, superior oblique, B, inferior oblique, C, medial rectus, D, lateral rectus. Your time starts now. The answer is, the shortest EOM is B, inferior oblique. See, the longest and thinnest EOM is superior oblique, shortest will be inferior oblique, and muscle with almost no tendon is also inferior oblique. Among recti, this is for the overall muscles. Among recti, the longest muscles is lateral rectus, and shortest with less tendon is medial rectus. The next question will be, extension phenomenon is seen in option A, parietal lobe lesion, option B, occipital lobe lesion, option C, multiple sclerosis, option D, temporal lobe epilepsy. Your time starts now. And the answer is parietal lobe lesion. Extension phenomenon is when you present two stimuli simultaneously on both sides of the visual field, the patient will not be able to recognize the one in the field contralateral to the lesion, but it may be detected when presented alone. This is usually seen in parietal lobe lesion, just like hemi-neglect. It is more like hemi-neglect. When you present individually, the patient will be able to recognize, but simultaneously, if you present the two stimuli on both the sides of the visual field, patient cannot visualize on the side contralateral to the lesion. The next question, please. The drug of choice for this keratitis is option A, chlorhexidine and bromelain, option B, amikacin 2% eye drops, and option C, fortified cefazolin eye drops, and D, amphotericin B 0.3% eye drops. And your time starts now. And the answer is amikacin 2% eye drops. The diagnosis is nocardia. Actually, it has a typical wreath pattern keratitis with non-specific punctate epitheliopathy and margins with pinhead-sized superficial infiltration. Amikacin is the first line of treatment, and second line can be gentamicin or tobramycin. Next question, please. All are true about orbicularis oculi muscle except A, the orbital part is responsible for blinking, And B, contraction of the lacrimal part of the orbicularis oculi is important in tear drainage. It is innervated by the facial nerve. Option D, paralysis causes ectropion. And your time starts now. And the answer is orbital part is responsible for blinking. The explanation will be the orbicularis has three parts: orbital, palpebral, and lacrimal. Orbital part, it forms the ellipse without interruption at the lateral palpebral commissure. Palpebral part, it has two components, pretarsal and preseptal. Pretarsal is responsible for the spontaneous blink, and the lacrimal part, the preseptal fibers are responsible for the tear secretion. Next question, please. Moon crater-like endothelial changes are seen in option A, Fuchs endothelial dystrophy. Option B, congenital hereditary endothelial dystrophy. Option C, posterior polymorphous endothelial dystrophy. Option D, Murin's ulcer. And your time starts now. And the answer is option B, congenital hereditary endothelial dystrophy. In Fuchs, we will be seeing beaten metal appearance. In posterior polymorphous dystrophy, railroad track appearance. In CHED, we will be seeing moon crater-like or pod orange appearance of the corneal endothelium. With this question, my section gets over. And next one will be, I'm handing over the mic to Dr. Gunjan Badiraja, who is a cornea consultant in I7 Eye Hospital in New Delhi. She has numerous publications in indexed journals, both international and national journals, have many award-winning presentation in Delhi Ophthalmological Society and National Conference. She has special interest in refractive surgeries, ectatic disorders, corneal disorders, endothelial keratoplasty, and dry eye. And welcome, Dr. Gunjan Badiraja.
Thank you, and let's begin with our set of questions. Okay, so my first question is, which is not a protocol for cross-linking? The options are A, Cretan protocol, B, Athena protocol, C, Dresden protocol, D, accelerated protocol. And the time starts now. So let's move on to the answer. So the answer is B, Athena protocol. So all the protocols are definitely there, but the B, Athena protocol is actually Athens protocol, which combines topo-guided partial PRK and cross-linking to correct the highly irregular corneas with keratoconus and also post-LASIK ectasia patients in some. So let's move on to the other question. The second question is, TILK is not indicated in. The options are pellucid marginal degeneration, B is severe keratoconus, C is keratoglobus, D is keratoprosthesis. The timer starts now. So moving on to the answer. The correct answer is D, keratoprosthesis. So in all the options, TILK is indicated, and we have to correct these severe problems of ectasia with TILK, which provides more mechanical strength. It's called tuck-in lamellar keratoplasty. Moving on to the third question. The question is, what is not true for PDEC? The options are A, donor can be younger than 40 years. B, graft is thicker than DMEC. C. Involves transplantation of posterior stroma, decimates membrane. D. Graft thickness is around 25 to 30 microns. The timer starts now. So the correct answer for this question is C. Involves transplantation of posterior stroma and decimates membrane. So we all know what is PDEC. PDEC is pre-decimates layer transplantation, and it involves the correction. It involves the transplantation of decimates membrane and endothelium, and we do not do posterior stroma transplantation in these cases. Moving on to the next question. Preparation of fortified tobramycin eye drops requires dilution of tobramycin IV injection 40 mg per ml with tobramycin solution 0.3% in what quantity? So the question and the options are A, 3 ml injection in 10 ml solution, B, 2 ml injection in 5 ml solution, C, 3 ml injection in 5 ml solution, and D, 2 ml injection in 10 ml solution. Please read all the quantities carefully. The timer starts now. So the answer is B, 2 ml injection in 5 ml solution. So we would have made some fortified tobramycin in our clinics. So we take 2 ml from injectable vial of intravenous tobramycin and we inject 2 ml to a 5 ml bottle, and then that is how we prepare the tobramycin drop of 0.3%. Let's move on to the next question. What is not done in the management of acute eye drops? The options are A, C3F8 injection, B, compression sutures, C, manual DALC, and D is corneal cross-linking. Your timer starts now. So the answer of this question is corneal cross-linking. So if we have read the question carefully, it says acute eye drops. So usually we do not do corneal cross-linking in acute eye drop case. We do all the C3F8 injection, compression sutures, as well as we carry on for the transplantation also in some cases. So this set of questions is over. Moving on to the next set of the questions.
Yeah. So thank you. The first set of our today's quiz is over with the 5 sections. So this is a time for commercial break. Thank you, Microvision, again. So now it's time to declare the winners of the last episode. So these are the winners from the postgraduate category and the private practitioner categories from the last episode, that is episode 3. Requesting everyone to please put up the message in the question and answer this section so that we can let you in at the end of the today's quiz. I hope everyone has noted. So with this, we move to the next set of questions. So I welcome Dr. Nayana Madam again for the next set of the questions.
Yes, now we will go to section 6. The first question is, you use the test shown across to refine the refraction for a patient. The patient says red letters are much clearer than the green letters. So the patient is option A, overplus or myopic, B, over minus or hyperopic, C, anisometropic, D, astigmatic. Your time starts now. Yes, the answer is A, overplus or the patient is still myopic. Now the explanation is, this is the duochrome test that we do. In myopic eye, the red light of longer wavelength is closer to the retina, while in hyperopic patients, the green is closer. So if the red-green test is used and a myopic patient is insufficiently corrected or undercorrected on the red side, the alphabets will be clearer, and hence they will require more minus power for green to be as distinct as red. So ideally, you should have both colors equal. Next question. Which of the following is not a physiological property of vitreous? The options are: A, it transmits 85% of the light of wavelength 300 to 1400 nanometers. B, prevents the globe from collapsing. C, refractive index is of 1.66. D, allows accumulation of waste products such as lactic acid, which can be toxic to the retina. Your time starts now. The answer is C. Ideally, the refractive index of vitreous is 1.33, and it consists of mainly 98% water, 1% macromolecules, and remaining solutes and low molecular weight materials. Next. Question 3. During hydrodissection of the lens, while doing cataract surgery, the iris prolapses, the chamber shallows, and the eye becomes firm. But the glow is unchanged. What is the likely diagnosis? A, ciliary body edema. B, zonular dialysis with vitreous prolapse. C, misdirection of irrigating fluid into the anterior vitreous. D, expulsive choroidal hemorrhage. Your time starts now. The answer is misdirection of irrigating fluid into the anterior vitreous. And how this can happen? This is the explanation. During hydrodissection of the lens in the cataract surgery, the iris prolapses, the antechamber. I think the question is repeated here. Okay, the diagram says, it shows when you do hydrodissection, you can see the infused fluid going through the zonules into the vitreous behind the lens. It pushes the anterior vitreous, but without any loss of red reflex. Whereas in choroidal hemorrhage, similar things can happen, but the red glow is lost. Next. Which of the following structures passes outside the tendinous ring in the superior orbital fissure? The options are: A, the optic nerve. B, trochlear nerve. C, abducent nerve. D, the oculomotor nerve. Your time starts now. The answer is the trochlear nerve. You can see that this is the annular tendinous ring. Here, trochlear nerve is outside it, whereas the optic nerve, oculomotor nerve, both the divisions, and the abducent nerve, they are inside it. Next. This is the final question. 75-year-old female with a stroke in the area of inferior division of cranial nerve 3. Which extraocular movements would not be affected? A, adduction. B, elevation. C, depression. D, cyclotorsion. Your time starts now. The answer is B, elevation. The explanation for this is that the superior division supplies the superior rectus and the LPS, whereas the inferior division, it supplies inferior oblique, medial rectus and inferior rectus. Hence, the elevation will not be affected here. I think this is the last question for me. Thank you.
Yes. So next, who is
I hand over to Dr. Sarika.
Yeah.
Yes, so moving on to the next section, 7. Can we have the question, please? So the first question, our options are A, corneal thickness, curvature and hysteresis. B, only corneal curvature. C, corneal thickness and curvature. D, only corneal thickness. Your timer starts now. We are using these image techniques. So the correct answer is, it measures the corneal thickness and curvature. So the rotating Scheimpflug imaging technique is used in instruments such as pentacam, and it measures the anterior as well as the posterior surface of the cornea. It gives us the thickness as well as the curvature and pachymetry of the cornea. Can we have the next question? So centrad is a unit used for the measurement of, your options are RNFL thickness, corneal hysteresis, squint, VEP. Can we have the timer, please? So the correct answer is squint. So centrad is another unit used for the measurement of prism power. It is less frequently used as compared to prism diopters, and it is represented by the symbol. So 1 centrad represents the deviation of light by 1 centimeter and perpendicular to the initial direction of the light ray on an arc of a circle 1 meter away from the prism. Isotretinoin, a cream used to treat acne, can cause. So these are the side effects. A, papilledema. B, pseudotumor cerebri. C, none of the above. D, all of the above. So isotretinoin is a commonly used cream to treat acne. It also have some side effects on the eye. So the answer is all of the above. So these are actually the ophthalmic manifestations of isotretinoin. So the more common ones are dry eye disease, meibomian gland dysfunction, and conjunctivitis. And the less common ones are visual field defects, color blindness, ocular myasthenia gravis, optic neuritis, and retinal toxicity. So the next question. Citicoline is a drug used to A, improving muscle function in myasthenia gravis. B, improving muscle function in myasthenia gravis. Repeated. C, maintaining pupil dilatation in floppy iris syndrome. D, improving nerve function in advanced glaucoma. So your timer starts now. So the correct answer is D, improving nerve function in advanced glaucoma. So citicoline is actually a neuroprotective drug. So it is also used to treat amblyopia and also glaucoma. So it can improve the retinal and post-retinal visual pathways by stimulating the dopaminergic system. So we can have the last question of this section. In the primary position, the primary action of superior oblique muscle is. Your options are A, elevation, B, extorsion, C, depression, D, intorsion. Your timer starts now. So the correct answer is D, intorsion. So these are the muscles, and the primary action of the superior oblique is encyclotorsion or intorsion, and inferior oblique it is extorsion. Superior rectus, of course, elevation. Inferior rectus is depression. Lateral will be abduction, and medial rectus is adduction. So we come to the end of this section, and moving on to section 8, I would like to hand over to the next quiz master,
Pravrisha.
Dr. Pravrisha.
Yeah. So let's begin with the questions. Which drug is being tested in the Kingfisher randomized clinical trial? The options are A. Brolucizumab, B. Fasinumab, C. Aflibercept, and D. Dexamethasone. So, the answer for this question is option A, brolucizumab. So this trial, they're basically for the patients for diabetic macular edema, and they have compared the safety and efficacy of 6 milligram brolucizumab versus 2 mg of aflibercept injection. And they just found that overall the efficacy was similar. However, brolucizumab, it showed significant anatomical improvement as compared to aflibercept. So the next question. So what is common between Robin Cook, Sir Arthur Conan Doyle, and William H. Coles? All of them are renowned authors, we know. So the options are all had retinal detachment. Option B, all had undergone refractive surgery. Option C, all of them are ophthalmologists. Option D, all have primary open angle glaucoma. And your time starts now. And the answer is option C. All of them are ophthalmologists. So Robin Cook, we already know he is a famous thriller writer. So he had completed his MD ophthalmology and practiced in Harvard University. Sir Arthur Conan Doyle, obviously the famous writer for Sherlock Holmes, he has done ophthalmology from Vienna. And Dr. William H. Coles, he is a renowned ophthalmologist from State University of New York, Buffalo. So the next question. What is the diagnosis? We can see a histopathological picture. So what is the diagnosis? The options are A. Callejon, B. Basal cell carcinoma, C. Retinoblastoma, D. Sebaceous gland carcinoma. And your time starts now. So the correct answer is B. Basal cell carcinoma. So already, as explained, that BCC is overall the most common eyelid carcinoma. However, the scenario is different in India. It is the SGC, and there are several clinical types also, as already discussed. So this here, the histopathology, it shows large basaloid lobules with peripheral nuclear palisading pattern and with a high mitotic activity. So this peripheral nuclear palisade is a characteristic histopathological sign of basal cell carcinoma. Next question. Which of the following is false? Options. Jos Baraker is known as the father of refractive surgery. Option B. Excimer laser was introduced by Dr. Rangaswamy Srinivasan. Option C. Radial keratotomy was first performed by Dr. Sutomu Sato. And option D. Femto laser was introduced by Dr. I.G. Palikaris. And your time starts now. And the correct answer is option D. Femtolaser was introduced by Dr. I.G. Palikaris. So femtolaser, it was developed by Dr. Imola Ratketrop, Dr. Tibor Juhas, and Dr. Ran Kurtz in the early 1990s. Whereas Dr. I.G. Palikaris, he introduced epiLASIK. So this technique, as you all know, it doesn't make use of alcohol, and therefore it is less painful and causes less limbal stem cells damage. So with this, we move on to the last question. So all the structures develop from neuroectoderm except the options are optic nerve, option B, retinal pigment epithelium, option C, smooth muscles of iris, and option D, lacrimal gland. And your time starts now. And the correct answer is option D, lacrimal gland. So lacrimal gland, it develops from the surface ectoderm. The other structures which develop from surface ectodermal lens, eyelid skin, primary vitreous, corneal epithelium, and conjunctiva. Whereas the structures which develop from the neuroectoderm are optic nerve, retinal pigment epithelium, smooth muscles of iris, ciliary body epithelium, and secondary and tertiary vitreous. So we come to the end of this section. So next I would hand over for section 9 to Dr. S. Vanipriya, madam.
Thank you, Prabhisha, madam. We'll move on to the next question. Lens newtons is option A, subconjunctival dislocation of the lens. Option B, lens fixed to the cornea. Lens fixed to the retina. Option D, lens floating in the vitreous. Your time starts now. Answer is lens floating in the vitreous. So lens newtons is posterior dislocation of the lens floating in the vitreous. Lens fixata is posterior dislocation of the lens fixed to the retina. Phacoceal is into the subconjunctival space. The next question is the largest Purkinje images. Option A, first image. Option B, second. C, third image. D, fourth image. And your time starts now. And the answer is C, third image. First, second, and third images are reflected from the convex surface. So they will be erect and moves in the same direction. Among this, the brightest image is the first image, largest will be the third image. Fourth image is reflected from the concave surface of the posterior lens surface. So it will be inverted and small, dim, and moves in the opposite direction. Next question, please. Causes of retinal arterial pulsation are all except A, papilledema, B, aortic aneurysm, C, exophthalmic goiter, D, increased IOP. Your time starts now. And the answer is papilledema A. See, the venous pulsation is a normal finding seen into 10 to 20% of the people, but arterial pulsation is always pathological. And significance of venous pulsation is it is absent in papilledema, which is one of the earliest sign in papilledema. And true arterial pulsations, which is seen all over the retina, the causes will be aortic regurgitation, goiter, aortic aneurysm, and the retinal pulsation, arterial pulsation confined to the disc is mainly due to high IOP or very low IOP sometimes. Next question, please. Which chart of Amsler grid is preferable in the presence of central scotoma? Option A, chart 1, B, chart 2, C, chart 3, and D, chart 7. Your time starts now. And the answer will be B, chart 2. And we have 7 chart in the Amsler grid. Chart 1, which is routinely used. Chart 2 has central 2 diagonal lines that aid the fixation for patients with a central scotoma. Next question, please. ERG is normal in A, retinitis pigmentosa, B, optic atrophy, and C, Leber's congenital amaurosis, D, congenital stationary night blindness. Your time starts now. And the answer is B, primary optic atrophy. ERG is detect functional abnormalities usually in the outer retina up to bipolar cell. So in optic atrophy, beyond this will be affected. So VEP is very useful in that case. And thank you. I'm handing over the session to next quiz master.
Dr. Gunjan.
Thank you so much. So moving on to section 10, the first question is, what deposits are commonly seen in macular corneal dystrophy? The options are A, amyloid, B, mucopolysaccharides, C, hyaline, D, amino acids. Your timer starts now. So moving on to the answer, the correct answer is mucopolysaccharide. I hope everybody would have seen in the quiz by Dr. Naina as well. So this is a macular corneal dystrophy, which is very rare and autosomal recessive, and it begins in early years of the life, and it has superficial gray white opacities in the middle of the cornea, and these with age spread to the periphery. So they compose N-acetyl glucosamines, and also they have unsulfated keratins. Moving on to the next question. What is not a treatment for dry eye disease? The options are amniotic membrane transplant, B, autologous serum drops, C, Lipiview, D, intense pulse light. The time starts now. The correct answer is C, Lipiview. So we all know that these all are treatment for dry eye, and Lipiview is the diagnostic tool to see the meibomian gland anatomy. And we also have different lenses in dry eye treatments. So moving on to the next question. Question number 3 is, which is the worst and annoying HOA after LASIK surgery? The options are A, starburst, B, trefoil, C, coma, D is spherical aberration. The time starts now. The correct answer is B, trefoil. So HOA stands for higher order aberrations, and the most annoying is the trefoil because it causes a triple formation of the images, and the patient complains of a Mercedes star seen due to the halos. So coming on to the next question. Identify this corneal condition. So the options are microsporadial keratitis, B, candida keratitis, C, Avellino corneal dystrophy, D, corneal scraping will confirm the diagnosis. Your time starts now. Look at the picture carefully and answer your question. The correct answer is C. Avellino corneal dystrophy. So what is corneal dystrophy, Avellino type? It is a combination of granular dystrophy and also it has also combination of lattice corneal dystrophy. So these develop in the stromal layer before the age 20. Coming on to the next question. Number 5 is identify this technology. The options are femtolaser assisted capillary access, B. Terminal chopper, C. Small incisional lenticule extraction, D. Zepto assisted capsular access. Your time starts now. The correct answer for this question is D. Zepto assisted capsular access. So the Zepto is a kind of technology which uses precision pulse capsulotomy and creates a good capsulotomy which is very stable, and it's stabler than femtosecond laser assisted cataract surgery created capsular access. So thank you so much for this fun quiz. I enjoyed it and hope you also enjoyed, and the prizes will be coming on to very soon.
Thank you, Dr. Gunjan, for wonderfully taking us through and all the quiz masters. So students, this was classic women power. Were they tough on you? I hope they were not. They are, all of them are so beautiful and good looking and, so attractive. I hope they didn't really trouble you much with their questions. I'm very sure when I go through the questions, yes, they were of an intermediate level. So I hope it was not deceptive at all. So, and I hope you must have done, all of you must have done absolutely great. So now it's time for us to have people who fared quite well, who were amongst the top 10 in the PG categories and the best 3 practitioners, top 1, 2, 3, to have them on a Zoom platform and have some chat with this performance, means the winners of the last episode. So Mr. Sai, can you let them in?
Yeah, only one has accepted to join.
Okay.
Already entered.
Okay. Can we have them? What's his name?
Team Macula.
Team Macula. Okay. So they were placed at number which last time? Team Macula. Okay, that's the team. Okay. 1 minute. Yeah, I think so. So the team Macula last time were at number
3, sir.
number 3. So it's Q Mandal and Sharmila S.
Yes, sir.
Correct?
Yes, sir.
So this was your this was the 4th episode. In last 3 episodes, where were you? Last time you were on number 3. And number in
was 3.
number 1,
10 था, sir.
पहले इसमें 10 था.
Yes, sir.
First episode. Second episode?
3.
And the third?
3. Oh, no. Third one, don't know.
Okay, that was the third one which we shared today.
Sir, आज third sir
It's
था.
the 4th episode.
Sir, third था, sir.
Third tha. Okay, where are you from?
AIMS Raipur, sir.
AIMS Raipur. So who is your mentor?
Dr. Somen Misra.
Somen Mishra sir. Very good. And what about Dr. Ankur? He doesn't mentor you?
Sir, he's mentoring other team, sir.
Okay. Well played. So we have the best of the teachers today here. Dr. Veni Priya is again a faculty. Dr. Nayana Poddar, she's a head of the department at Mumbai Topiwala Medical College. So ma'am, how do you look at this young smart students who fared into number 3 position in the last episode? Yeah, Naina ma'am, Veni Priya ma'am. Veni Priya is a person who writes a lot of books for about how to crack various exams. So how do you look at the students now?
It's a great achievement, sir. Among nearly from 300 students, they have topped in the 3rd place. So they are in correct path, actually.
So very good.
Thank you.
Glad
the
to
best.
know, sir, that they are all reading and keeping themselves updated.
That's great. So congratulations once more.
Thank you, sir.
You remember that it is going to be the best of the 5 out of the 8 episodes, which we are having preliminary episodes. So don't just lose the steam or get too elated and forget to play the next teams, or just keep on preparing. I would like to see the team Raipur in the semi-finals and finals for sure. At least Dr. Somen Mishra and Ankur, who are very dear friends of mine. Okay. Congratulate Dr. Somen Mishra, sir. Last time also your team from AIMS Raipur made it into, I think, semi-finals.
Semi-final, yes.
So this time we expect you to be into the last. I see Dr. Meghna Kandi over there. She is from AIMS.
Yes, sir. From
Can you
AIMS
get your visual on? Video on? Get your video on better. Any other teams have logged in?
Team Jishnu.
Okay. So Team Jishnu, Dr. Meghna, you can just log in, get your video on. Team Jishnu, meanwhile, can we have you with us? These are habitual. These two people, Jishnu, are habitual winners, you know. So I don't have much to chat with them, but I can ask the new quiz master to chat with them. I can call them a habitual offenders or a habitual winners. Yes, Team Jishnu, get your video on. Where are you? They have not yet joined.
I have invited them already, doctor. They'll join.
Dr. Meghna, can you hear us?
Yes, sir.
Why can you get your video on? You were on number which this time? Last time, I mean last episode?
Last time 7, sir.
Very good. She's from Nagpur, so I'm very proud of that. Correct?
Yes, sir.
And who is your proud mentor?
My mentors are Dr. Pooja ma'am and Dr. Purvasha ma'am, sir.
I see Dr. Purvasha on the panelist list. Dr. Purvasha, can you be with us? Yes.
Good
There.
evening, sir. Happy New Year to everyone.
Same to you. So Dr. Purvasha is a cornea surgeon and a faculty at AIMS Nagpur, and her face is glowing naturally because the student is performing so well. So
100%.
So we have all the faculties here, Purvasha. How do you feel when you're sharing a dais or a screen as a proud mentor of a successful student? How do you feel it?
I think for a guru, seeing their students shine so well is like anything better than what I could have done. So I think I'm really grateful to these students for doing so well.
Okay.
And
So this second consecutive week when I'm having Purvasha and Meghna with us. Last week, Meghna was with us for All India Postgraduate Teaching Program, and she presented a wonderful case on
PUK.
PUK, I should say, peripheral ulcerative keratitis. She is just a second year student, but her confidence was so great. She addressed most of the questions. So for the just for the information of other quiz masters like Professor Nayana and Venipriya, AIS ARC is conducting a PG activity on every Thursday, 8 to 9 p.m. So last episode, we had two short cases. One was presented by Meghna, and she really did well. And she answered so boldly most of the questions which were asked by the externals, who were all thorough, big cornea surgeons from across the country. And naturally, again, I had seen that time Dr. Purvasha bringing the glory of her student. That's very well done. So,
Another thing, sir, for Meghna, we've just started our postgraduate courses 2 years ago, and last year she wanted to participate, and there was this concept of having a team of 2 or 3 people. So she was not able to participate as a solo participant. So she was feeling very bad that she was disqualified. So I think she's making up for it this time. So glad that Samarpita is here with her.
she is playing well, but Dr. Meghna has not changed her team name, and it is going by a solo name of Dr. Meghna Kandi. I hope next time it will be team name.
Yes,
Okay.
sir.
So
They're
who is
head over heels, as you can see.
they are head over heels. Congratulations. Well played, both of you, and congratulations to the proud mentor.
Thank you.
Keep them well prepared for the following episodes as well. Okay. Any other teams have joined in? Sai?
Acumen has joined.
Team Acumen, can we have you with us? Dr. Saumil Jain and all are seen. Are they the winners? Yeah. So this is Shruti Nair.
Yeah.
So this is your team?
Yes, sir. Good evening, sir. We're Team Acumen. I'm Shruti and Fatima. We're final year residents from Jipno, Pondicherry.
Okay, Jipmar Pondicherry. Is it because Dr. Venipriya is from Pondicherry, she shared some of the questions with you?
Actually,
No,
I
sir,
think we
I
got
haven't
most of
revealed.
her questions wrong.
I haven't revealed that I am a quiz master. Somebody came and told me, ma'am, you are there today. Yes. I didn't tell
Just
anyone.
the way this Pondicherry Jipmar girls are always there. I think the team Jipmar is always there since last 3 seasons we have been doing. They have made it into quarterfinals, and one of the first episode they made it into the finals. So well played. And who is your proud mentor?
Nirupama, ma'am.
Oh, Kasturi ma'am. Okay.
Yes.
Well, congratulate her on behalf of the whole team of us. So very well played. Keep playing
Thank
like
you.
this. And we would love to see you in the quarterfinals as well as finals finally. Okay? Keep playing.
Thank you.
Okay. Doctor Vasavi Karupati, you are part of a mentor or? Ophthalm nerds. Dr. Ophthalm nerds is there. So Dr. Vasavi, can you get your video on and join us? She was on number 4 last.
Good evening, sir.
So you were on number 4 last time, correct?
Yes, yes.
So can you just introduce your team as well as
So
your
my partner is not with me today, so she is in duty. So I
Okay.
played today's role. I'm from Andhra Medical College, sir. Visakhapatnam.
Visakhapatnam. Okay, well played. Well played. So who is your mentor?
Vishwamitra ma'am, sir. Dr. Vishwamitra.
So congratulations once
Thank you,
more
sir.
to all of you and keep playing. I hope to see you in the finals this time. I want a team from Andhra this year. Okay?
Thank you, sir. Okay.
Well played. Thank you, ma'am. I think that's all we have today, people who have joined in, logged in. So the best performance of this particular episode, we will be sharing with you or declaring with you in the following episode during the mid time of the quiz. So till then, it is time for us to say bye-bye. It's time for me to really thank all the quiz masters for making so much of effort for all these young students of mine. Thank you, Dr. Gunjan, Dr. Sarika, Dr. Prabrisha, Dr. Venipriya, and my dear friend, Dr. Naina, ma'am, whom I keep on pulling on and off, though she is a professor and head of the department of such a big institute. So thank you once more. It's time for us to say goodbye. And students, we will be meeting now directly on 17th of January, again at same time, 8 p.m. with new set of quiz masters and new set of questions. So keep preparing. That is going to be the 5th episode, and you should try to score better and better. And remember, because it is the top best 5 performances which will be cumulative, and the average of it will decide who are going to make it into the quarterfinals. So till then, it's time for us to say bye-bye. Thank you, everyone.
Thank you.
Bye-bye.
Thank you.
Hi, sir. Thank you. It was great.
Bye.